Global illumination is a technology that has recently become available, and it is actually a 3D technology that is substituting for all the other 3D technologies we have seen so far. The one that most of us are using at the moment is shaded volume rendering. So the surface shading provides depth information. Now, as you go to global illumination, you get an even better and more naturalistic display of images. Actually, some of the especially vascular images look like a real 3D model that you see, for example, in some of the body world exhibitions in which you see small little detail in exquisite image quality. We use global rendering mainly for communication with our surgical partners, but also other physicians, and most recently also with our patients. We see there's an increasing need for patients to understand before an operation what is actually going on, how large their lesion is, how complex the situation is, and what the potential dangers and complications are because the lesion is, for example, attached to a vascular system. For that, global illumination is a technology that provides all the details that patients would like to see in their practice. What makes it especially interesting is that you can interact with the 3D rendering in a way that is totally interactive, which basically means that if you want to turn things around, if you want to move things out, this is possible. In order to eliminate structures, you have to do some editing beforehand, and you can switch on and off structures so that you can reveal areas that are behind or in front of a structure and make the whole thing more clearly visible. The technique is available in a workflow where technologists are actually performing the pre-structures analysis, for example, when it comes to evaluation of the renal arteries and vascular anatomy in renal donors, or when it comes to, let's say, the structural analysis of the aorta before valvular surgery or valvular implantations, or endoluminal implantations of stents in the descending aorta and the abdominal aorta. In all these workflows, you can use technologies to do the processing. But what is especially interesting is this interactive aspect that makes it possible for us to demonstrate things also in a clinical conference and really answer interactively the questions that may arise from our surgical partners. So altogether, I think global illumination is a real breakthrough when it comes to visualization of radiological images.